This Week in Richmond is made possible in part by Dignity Memorial, caring for our communities with a network of funeral homes and cemeteries in Virginia and throughout North America. More information about Dignity Memorial's providers is online at dignitymemorial.com.
Alpha Natural Resources. Consistent with its Running Right process, Alpha is an energy company committed to being a leader in mine safety and an environmental steward. We fuel progress around the world. More information at alphanr.com.
Haley Buick GMC, the place for a new Verano or Terrain Denali, on Midlothian Turnpike in Richmond and online at haleybuickgmc.com. Taking it to the streets and helping our community. The Virginia Chamber of Commerce, the voice of the Virginia business community, working in legislative, regulatory, and political arenas to promote the free enterprise system. Information at vachamber.com.
I just received a letter from a student who thanked me for instilling the love of math in him. That's why I teach.
Brought to you by the Virginia Education Association, because a good education is good for everybody.
Additional support is provided by these sponsors. And by the members of Virginia's public television stations. Thank you.
Welcome to This Week in Richmond, and a very special welcome back to Secretary John Harvey, Secretary of Veterans and Defense Affairs, and a welcome for the first time to Deputy Secretary Jennifer Lee, Health and Human Resources. Appreciate very much both of you being on. We could talk about veterans issues for the entire time, about healthcare issues, but the interesting part to our viewers is the interconnection between these two secretariats and the work that together you're doing on veterans issues. Now, if someone goes on the website and checks your backgrounds, they'll not be surprised because of your military service, Admiral, that they would know your interest. But then Dr. Lee, emergency physician, but if they go on your website that we'll put these up, they can check you out. Then they'll see all of your connections with veterans issues, as whether a White House fellow or involved in other ways with undersecretaries on veterans issues. So a natural fit for the two of you to be colleagues on veterans issues. So help our viewers better understand, whether it's telemedicine or others, how the work that you're doing, not in separate silos, as some would say, but doing connected. They're really trying to improve the lives and the health care of Virginia's veterans. What, 800,000?
Over 800,000
Over.
veterans in Virginia, fastest growing veterans population in the United States. Well, I'll get it going, Dr. Lee. I think the partnership, and I think it needs to be said, it's a partnership in the fullest sense of the word between Health and Human Services and Veterans Defense Affairs, is driven by two big things. First one is the governor.
Yes.
The governor
right.
expects the
Yes.
cabinet to come together, work together, and do what it takes for the people of Virginia and to advance their well-being. And so that's very much the tone and tenor and direction that he sets. The second thing was, we came into office about the same time of this growing awareness of the catastrophe that overtook the Veterans Administration in several different areas, one of which was access to health care for a variety of reasons. This was the wait time issue that exploded, across the country, from Phoenix to Hampton, up north, wherever there was a Veterans Medical Center. So we came into office at the time of this growing crisis. And the governor's take was, okay, how do we bring the resources of the Commonwealth together on behalf of Virginia's veterans to help mitigate what's going on within the Veterans Administration and the very great difficulties that they were experiencing. So that's where we came together, kind of in a sense of crisis, and then have stayed together okay, we learned a lot, we did a lot, And now, how do we continue to work together on behalf of Virginia's veterans to improve their access to the health care that they've earned?
Dr. Lee?
That's absolutely right. Another of the governor's major priorities is ensuring access to health care for everybody in Virginia. And who, more important or more of a priority than our veterans and their families. And so last year, again, as the VA access crisis was unfolding, we also were fighting our own battle here in Richmond to ensure access to care for those who are low income by closing the coverage gap and expanding the Medicaid program. Obviously, that didn't work out last year, and so after that, the governor asked us all in the administration to see how we could enhance access to care and ensure, the best health for everybody in Virginia without, Medicaid expansion. And one of the things that was happening at that time was that in D.C., Congress was working on and about to pass the Veterans Choice Act, which was supposed to be the response to some of the wait time issues at the VA. And so the governor saw that, and we saw that as an opportunity to work together with the VA and help ensure better access to care for veterans who are having challenges getting to be seen.
How do you hear that this is working out, or hopefully it is working out, that the wait time is not as long?
Well, we stay on top of that pretty closely. We've been out to Salem, to the VA Medical Center in Salem, and to McGuire here in Richmond, and particularly down south in Hampton at the VA Medical Center, which is kind of the hot zone in Virginia for the growth, the extraordinary growth in the number of veteran patients that have to be met, and the challenges in clinical space and maintaining the right type of staff and sufficient numbers of staff in order to meet the growing demand of those veterans. So Dr. Lee and I have established real partnerships with all the medical directors at the VA hospitals and the clinics. There are satellite clinics in the state. We stay on top of the data, and we work very closely. Again, our take has always been, hey, anybody can point out what's wrong and be a critic. Okay, our goal was, from the governor, was get together, do what it takes to improve the access for care. So what could we bring? We being the private medical sector in Virginia, we being the state and helping to facilitate the engagement between the private sector and the VA to improve the veterans' access. How we went up and met with the governor, took us up, and we met with Secretary McDonald and his team about some real, Secretary Hazel pointed out some real critical choices we needed to make, changes we needed to make to the Veterans Choice Act. Those were enacted over time. The interpretation of the rules were changed, I think, in large part because of the involvement of Governor McAuliffe early on, saying this is what has to change so we can continue to help. So we stay in touch. There are things we can do. I think we're doing them. It can get better, and it will get better, and it's our job to make it better. So there's always more to do. But I think we've established, the strong partnership between Dr. Hazel's team, my team, and then the work we've done with the individual medical centers themselves to help them help themselves.
So when you think about the effort to get better, and that's your goal, it's the governor's goal, what are some of the major issues that you see that you'll be working on, whether it's this year or next year or through the governor's administration? What are some of the, what would you call them, challenges? I won't call them obstacles, but challenges. What are some of the, what are you working on now? Dr. Lee, you want to start?
Sure, I'll start. I think we have this great opportunity to help veterans, and we need to be at the forefront because, as Secretary Harvey said, we have the fastest growing population of veterans of any state in the nation. It's wonderful because we love that veterans want to live in Virginia, in the Commonwealth. But it also poses a challenge in that the demand is outpacing the capacity for care on the VA side. And I think one of the challenges we've seen is just keeping up with that in a system that is set up to not necessarily be the most nimble. in responding in a dynamic way to those kinds of changes. So how does, again, we work very closely with the Hampton VA, and we know their leadership is working very hard to meet the growing demand in the Hampton Roads area of the increase in veteran population. But can they hire the healthcare providers they need and get them onboarded
yes.
quickly? Do they have the space? What's the process to get that clinical space? It's usually not a very rapid process in response to that. So those are some of the challenges that we face, but they're not insurmountable.
I think the VA is just an extraordinary bureaucracy. And I've been part of big government bureaucracies for
Yes.
my previous life, so I know whereof I speak from the inside out. But I think the VA stands out, and Dr. Lee was very charitable in saying perhaps they're not as nimble as they need to be. You can talk about agile, flexible, all these buzzwords that get thrown around. And I think what we do is find those trouble spots, find those areas where we can intervene, point out, hey, if we can get this done in this area, that kind of breaks the logjam on a particular field. And I think we serve that purpose that helps them help themselves.
With the percentage of Virginia's population that are veterans, I would assume that some of them are watching right now. And I hadn't thought of this question before, but what if they had any suggestions, or if they had some concerns? What would you say to some of the veterans who are watching, or family members of veterans who are watching? Not gripes and criticisms. Mm-hmm. You can get those anywhere.
Right.
But if someone had a suggestion of something that might help their daughter, their son, their spouse.
Well, the biggest thing is to bring it forward. Bring it forward via either your elected representative, your delegate, your senator. Bring it forward directly to me at john.harvey@governor.virginia.gov. Bring the issue forward, because many times we responded to these individual issues that turn out to affect lots and lots of veterans, particularly in Virginia, where we have such a changing nature of our population. We've mentioned that it's growing rapidly, but the post-9/11 generation of veterans, the younger veterans, much higher percentage of them are women. And those women's veterans, medical issues, we're way behind the 8 ball in being sure that those are properly addressed, both within the state and within the VA, the big VA system as well. Steps are being taken, but we need to move them farther and faster. So the most important thing for us is to hear. That's why both of us get around so much, because we want to meet with the people, hear from the people, what are the issues, and then we sit down and say, okay, here we can go and get the biggest bang for our buck. It's going to impact the most people and do the most good in the least amount of time. But it's really important to know what the issues are, and not just go on some supposition that, we've got it all figured out, because we don't. We need to hear from the veterans and their family members about what's important, what's working right, and just as important to know what works,
Yes.
as what doesn't work, because you want to reinforce success and attack failure. So you need to know what we're doing right and where we need to improve. So we need to hear from people.
And we want to make sure that your web addresses are up on the screen, and people can, if they go to those web addresses, they'll then be able to get to your email and to send you a message. But you were about to say something. I interrupted.
I'm just going to add to that. Absolutely, Secretary Hazel and I would be delighted to hear from any veterans and family members in Virginia that are facing any challenges in accessing care, or that have ideas for how we can help. This is something that we have to work on together. The VA can't do it alone. We in state government can't do it alone. One of the things we want to do to address the problem is forge partnerships. Mm-hmm. And as Secretary Harvey said, we're going around the state. We together had a meeting down in Southwest Virginia in the New River Valley, a meeting that brought together VA leaders from the Salem VA Medical Center, from the Carilion Clinic, from the Area Agency on Aging, from all parts of the community, to see how can we work together to address these barriers to access.
And let me give you a great example from that meeting, because it just has stayed with me so profoundly. So we're in there, and one of the big issues was getting out in Southwest Virginia, the distance that the veterans have to have to travel to get to the medical center. And so many of them don't have easy access to transportation, which means no access to health care.
Sure.
So what do we do about that? So we're at this meeting, and it's the Allegheny Aging Association, this four-county
Area Agency
group.
on Aging.
This extraordinary woman comes forward and says, well, we already provide transportation to many of the elderly in this four-county area, and most of our buses and vans travel half full. So why can't we have the veterans use those vans that already
Right.
exist
Yes.
to get them to the clinics and the medical center? And it was stunning. I mean, she just came forward, here's my solution. And so we bring all these people together. Everybody has a toolkit. Not every toolkit has every tool you need. But when you bring the right people together between all the different toolkits, you will find what you need to solve that problem. And it's no cost, and it's already paid for, it exists, and how do we use it better? It was just a perfect example of what our efforts are all about. Another one that just recently came up, and I think Dr. Lee will remember this, the daughter of a veteran who was suffering from Alzheimer's contacted me and through her delegate and sent a very detailed history of the sad days of the end of his life and all the extraordinary difficulties that came with Alzheimer's in its worst form, if you will. It was just very, very difficult. And between the community, the local medical, the state, all the different people who had something to do with this, the coordination, to put it mildly, was sadly lacking. And it provided very difficulties, poor care to the individual, and incredible stress to the family. There's things we can do to help deal with that, and we are doing them. We did an investigation, we found out what happened and why, and we can keep that from happening again, I believe. But that's the type of thing that this effort is all about. Sometimes the changes are difficult, but many times it's putting together little pieces of the puzzle and just getting it right that way.
Right. We're trying to connect the dots to solve the problems.
Yes.
And a lot of times there's just not enough awareness of what the resources are that are out there, both from the VA side and the community side. So the least we can do is bring people together and raise awareness and enhance that coordination. And we need help to do that. We really need leaders from the communities all across the Commonwealth to help us in that, because it's every single community is different in what resources are available to them.
And let's underscore something that you said earlier, that in addition to contacting you, they have a local member of the House of Delegates and a member of the State Senate, and they could reach them sometimes even easier. They may live in the same community
Sure,
as they live,
sure.
Right.
and to get that, so they then can get in touch as they will with
and
you.
they're not shy about getting in touch with
No.
us when there's an issue to be
Right.
resolved. I'll give you, if I can, I'll give you another great example of something that the governor has led on and has said, we are going to do something to make a real difference, and that has resulted in a tremendous partnership between what Health and Human Services brings and Veterans and Defense Affairs, and that's veterans homelessness. You know, this is something that personally, before I got into this job, I had always assumed was just one of these intractable problems in our society that sadly is always going to be with us, and there's just nothing much you can do about it. That's where I was. Well, we came into this, and the governor signed us up for, no, we think we can do better than just accept this problem. We're going to make a difference and end it. And so under his leadership, and you know, he has said, get together, and we got together. And when we brought all the resources together, local organizers, local communities, nonprofits, individuals who just have spent their life doing this out of the goodness of their hearts, state government, county government, and access to what's available at the federal level, housing and urban development, we have made extraordinary progress in making sure that veterans homelessness in Virginia is a rare event. If it occurs, it's a brief, and it doesn't happen again to that individual. We've housed over 740 homeless veterans and their families since October of last year. We felt there was only about, from the point in time count from the year before, we only identified 614 homeless veterans and families affected. So we put together a system, as Dr. Lee said, connect the dots, that's really having a profound impact on this very, very significant issue in the state.
And Virginia is on track to end veteran homelessness.
Right.
And just two quick thoughts about that. One, I really have to say, as you mentioned, I used to work in the Veterans Administration, and I worked for former Secretary Shinseki, and he was the one who really
Right.
set out this goal and said, to those who were disbelieving that we were going to end veteran homelessness. And Governor McAuliffe stepped up and said that Virginia ought to be first in line to do that. And so through the partnership and collaboration of so many different stakeholders, we're actually on track to do that. And then second quick point is that, good health is so much more than just health care. And the point about homelessness, about having a place to live that's safe and secure is so important. But the other aspect, too, for ensuring veterans' health is sometimes the best thing you can do to help get a veteran healthy is to help them get a job. And so that's why Secretary Harvey's leadership in veterans employment and with the Department of Veterans Services is so important. I mean, it's more than just health care. It's all the other aspects of supporting well-being that help veterans stay healthy.
At the last meeting of Senate Finance here on Capitol Square, your Commissioner, John Newby, Commissioner of Veteran Services, was given a report, and I was intrigued to hear that I think more questions were raised by the senators on the homelessness issue. And I recall the commissioner saying, give an example of one homeless veteran who was a veteran from the Korean War, and that they're all ages.
Right.
They're not just the ones coming out of recent
Right.
time in service, and the legislators were really listening, and I think very appreciative and concerned that there were ones who were homeless, and I think the commissioner said that's an ongoing matter, because once you have everyone housed and no longer homeless, there are others that would be.
Right. If you have the fastest growing veterans population in the
right.
United States, that's not a problem that's ever finally solved.
Yeah.
But it's one
Stay
that you have
after
a
it.
structure in place,
Right.
a network in place that can respond extremely rapidly when a homeless veteran is identified, so we can we can make contact, get safe and secure housing, and attack the problem that caused the homelessness.
Before our time's up, thinking about other healthcare initiatives, it's somewhat striking, and maybe this is an editorial comment, but that the strong concern about medical services for veterans hasn't really carried over with all of the policymakers in the legislative branch to others who also are in need of health care. So having made that comment, anything that you'd want to say more about these months leading up to the next session? Is there a chance that we might see Virginia addressing more medical issues for non-veteran population?
Well, I really hope so. I think that it remains a priority of the governor to ensure that everybody has the opportunity to have good health. And that means getting access to health care, timely, quality access. I can just speak from my own personal experience as an ER doctor to what happens when people don't get that access. They can't get the medications they need to be on to control their blood pressure or their diabetes, and they end up in crisis coming to the ER, having a stroke or in a coma because they weren't able to control the chronic conditions that they have by just getting access to the medications and care that they need. And so anything we can do to ensure that
Emergency room
access.
care is the most expensive care in the United States. Somebody's going to pay for it. The taxpayers of Virginia will pay for that in some way. So perhaps instead of paying the most expensive way, it makes sense to intervene earlier with a system that makes sense, that's used broadly around the rest of the United States, and provide the care early on so you're focused on health maintenance and prevention of illness rather than responding to the crisis in the emergency room, which is an extraordinarily expensive and not always the best way to do it. I think the recent Supreme Court decision on Obamacare, I think will really set the stage for the next. The governor's view is very clear. He's not going to change. He was elected to by the people on that basis. And so I think you'll see this effort continue. I think it should continue. And I think the country's ready for it, and I think Virginia's ready for it.
Thank you very much, Secretary Harvey, Secretary Lee. Look forward to having a conversation with you again on This Week in Richmond. Thank you.
Absolutely. Thank you.
Thank you.
This Week in Richmond is made possible in part by Dignity Memorial, caring for our communities with a network of funeral homes and cemeteries in Virginia and throughout North America. More information about Dignity Memorial's providers is online at dignitymemorial.com.
Alpha Natural Resources, a leader in mine safety and an environmental steward.
Haley Buick GMC in Richmond and online at haleybuickgmc.com. The Virginia Chamber of Commerce, the voice of the Virginia business community.
The Virginia Education Association, because a good education is good for everybody.
Additional support is provided by these sponsors. And by the members of Virginia's public television stations. Thank you.